Good morning, good afternoon, and good evening, everyone. Thank you very much for joining this webinar, which is part of the Quality of Care Network National Forum series. Next slide. So before we get into the actual content of this webinar, just a brief overview of the Quality of Care Network, which is a broad-based partnership which was launched in 2017. It consists of 10 countries of committed governments, but also implementing partners and funding agencies who are working to deliver the vision that every pregnant woman and newborn receives good quality care throughout pregnancy, childbirth, and the postnatal period. The overall goals of the network is 1, to halve maternal and newborn mortality in specific health facilities in the network countries, as well as stillbirth by 2022. But then there's also the aspect of the improvement of the experience of care. The work has been envisioned to be guided by 4 strategic objectives of the network, which are the leadership, action, learning, accountability, sometimes referred to as the LALA framework. Next slide, please. So just an overview then of the National Forum webinar series. So a key objective of the Quality of Care Network is to document and share learning within, but also between countries. This is important to support policymakers, managers, and providers with opportunities to exchange and learn from each other, to share challenges and practical solutions, which are saving life with quality and dignity. And this exchange is needed at the national level among the network countries, but also with and among partners. And this National Forum's webinar series on quality of care for MNH provides a venue for sharing experience in adapting and implementing the MNH quality of care standard, the Quality of Care Network strategic objectives, and progress towards achieving the Sustainable Development Goals and their application during the COVID-19 pandemic. Next slide. So just a little dig further in terms of the strategic objectives. So in terms of the leadership, it's about strengthen or build quality of care health governance and management structures at both national but also subnational levels to sustain MNH quality of care actions. For the action part, it's about linking learning from MNH QI implementation sites with management and decision-making process at the facility and district level to align with local health system governance to advance the quality of care governance and quality improvement processes. Then in terms of learning, it's about establishing a learning system to support sharing of quality of care knowledge within and across districts and scale up quality of care practices from learning district to other districts in countries. And then lastly, around the accountability, it's about strengthening routine measurement systems to collect, report, and use quality of care indicators to help improve and sustain quality maternal newborn health care, but also to develop and implement accountability mechanisms that integrate community and stakeholder perspective into the overall work. Next slide, please. So I'm happy to share with you that today we will hear from Malawi and the lessons from implementing and scaling up quality of care for maternal and newborn health. We will have a presentation from Dr. Bongani Chikwapulu, who's the head of norms and standards in the Quality Management Directorate in the Ministry of Health and Population in Malawi. And then there will also be an opportunity for questions and answers, and this will be facilitated by Dr. Malagiso Mbwewe, who's the Deputy Director in the Quality Management Department in the Ministry of Health and Population in Malawi. And it will also be by the support of myself, Martin Dolsten, I'm situated in the WHO headquarters in Geneva. So with that introduction, I have the pleasure to hand over to Dr. Bongani Chikwapulu for the presentation. So Dr. Bongani, the floor is yours.
Thank you very much, Martin. I'll be sharing on the lessons from Malawi, looking at the MNCH status, the National Quality of Care Forum that we had recently, and the progress that we have made in line with the LALA framework and the next steps. So when we were joining the network around 2017, our maternal mortality rate was at 439 per 100,000, and the neonatal mortality rate was at 27 per 1,000 live births. As you can see, these statistics are quite outdated, and as a country, we're looking forward to the next demographic health service to give us a current figures. Around that time, poor quality of care was a big challenge, and it was reflected in our health sector strategic plan 2, which is ending this year. It was noted that only 42% of women and 60% of newborns received postnatal checkup at 48 hours post-delivery, and only 53% of hospitals and 5% health centers provide full package of CMOC and BMOC respectively. And it was so noted that there were high pediatric deaths due to malaria, diarrhea, and acute respiratory infections. One of the key factors that was noted to impact quality of care was the health systems factors. Nevertheless, government is committed to achieve universal health coverage of quality. Next slide. So looking at the statistics at national level using routine data from DHIS2, and this data was collected from August 2020 to September 2022, you see that there has been a positive shift from January 2022 to August 2022, denoting reduction of maternal deaths during that period. Next slide. But we're not seeing the same thing with neonatal deaths. I think the neonatal deaths have remained the same. We're hoping that if we have got 2 data points that are below the medium, the medium for October and November, we should be able to see another positive shift in the right direction for neonatal deaths. Next slide. So looking at the maternal mortality and stillbirth rates in 8 of the 9 learning districts, comparing statistics from 2017 and 2021, you actually see that 6 out of the 8 districts reduce their maternal mortality rate. This is institution maternal mortality rates. And for stillbirth rates, only 2 out of 8 districts reduce their stillbirth rate. So there's still more work, particularly in respect to stillbirth rate and neonatal death rate. Next slide. So we recently had a National Quality of Care Forum where partners, implementers, academia, different stakeholders came together to share the progress of implementation of the National Quality Management Policy which is ending this year, and also the quality of the MNCH quality of care roadmap. It brought over 400 participants, and it was officiated by the Minister of Health. We had in total 115 abstracts, and out of these 40 were QI, strict QI activity abstracts focusing on MNCH. Next slide. So going into the specifics, within the quality of care forum, we launched the National Quality of Care Standards. These are integrated quality of care standards. We also shared, the different stakeholders shared progress made in implementation of the quality management strategy and policy, implementation of the quality of care MNCH roadmap. And we also discussed in terms of how we move forward, because most of the documents, strategic documents, are ending this year. And the abstracts were put in themes around the strategic objectives within the quality management policy. So we had a theme on leadership and governance, clinical excellence, patient safety and patient experience, and data for action. We had 2 panel discussions on demanding for good quality care and also financing the quality agenda. Next slide. So going into the specifics in terms of the progress, starting with leadership. So the Quality Management Directorate has been championing quality in country since 2016 when it was established. And in the early years, we developed the National Quality of Care Management Policy. And this policy is ending this year, and there are discussions of a review of the policy to align to the new health sector strategic plan 3. There were other tools that we developed in line with the policy. So we also developed the national strategy, the roadmap on MNCH, the Malawi QI model, the MNCH quality of care standards and assessment tools. And just this year, we further adapted the MNCH quality of care standards into the national quality of care standards. Yeah, next slide. So the policy has got 7 strategic objectives. The first one is around improvement of health sector leadership, governance and accountability at all levels, improving the capacity of human resource, promoting excellence in clinical practice, promoting client safety, strengthening people-centered care, strengthening support systems for delivery of quality health systems, and increasing capacity and generational use of information. And as you can see, the policy took a health systems approach. Next slide. And we, through the network, we use the MNH as a pathfinder. Quality Management Directorate being a new department, we also needed to learn on how we can implement quality improvements. And for the MNH QoC, we've been spearheading it with the Reproductive Health Department. There was a coordinating committee at national level comprised of the Ministry of Health departments and partners that are interested in MNH, MNCH. We also selected 9 learning districts, and thus that's where we've been learning, and the progress that we're going to present are focusing on those learning districts. We have also established and capacitated the QI teams within the learning districts. Next slide. We also adapted the WHO MNH standards. The standards were 8 from WHO, but Malawi added a 9th standard. We further adapted the pediatric standards, and these standards were disseminated to the facilities within the learning districts, and we went further to do quality of care assessments. Next slide. And as I've indicated, we've further adapted the MNH quality of care standards and other standards that we used in country for accreditation. And I think this is also in line with a horizontal approach to quality of care, because we noted that most of the concepts that we being championed within the network are quite cross-cutting. So instead of having different blocks of QoC initiatives, as a country, we thought that we needed to have comprehensive national quality of care standards, and we integrate the quality of care assessments. And we already separate in terms of closing the gaps in terms of different interests for different partners and stakeholders. And we're hoping that these standards will be will not only be implemented in the public sector, but also in the private sector at all levels of care. One thing to point out is that the quality of care standards do not replace clinical guidelines. Actually, they support implementation of the different guidelines. The aim is to ensure that facilities are providing safe, effective, efficient, timely, and people-centered care. Next slide. So there are a number of service elements that have been adapted this far, and the service elements were guided by the common services that have been provided in Malawi at this point. And I think these service elements will keep on evolving depending on the expansion of different services at different levels. And the service elements are in 4 themes. The first thing is around leadership and management. The second is clinical support, ancillary support, and the clinical services. Next slide. So in terms of implementation of the National Quality of Care Standards, they'll use a stepwise approach. So depending on the adherence to the standards, facilities will be given stars 1 to 5. So the higher the star, the higher the quality of services that they are providing. So facilities will be, facilities that are being identified to implement the standards will be oriented. So the entry point will be managers within the facilities. So heads of in charges, heads of departments. So they'll be oriented to the standards so that they should take a leading role in terms of implementation of the standards in their respective departments. And an external assessment will be done, which will be followed by a quality improvement plan. And this plan will be an annual plan and will be integrated in the facility strategic plan, because what has been happening is that the quality improvement plans have been outside the strategic plan of the facility. So Going forward, we want that the plans are integrated. They are not seen as a separate plan. And the facilities will be supported in terms of implementation, and they'll also be encouraged to do safe assessments at least once a quarter, so that they can self-track. The idea is that we want implementation to happen whether an external team comes or not. I think this is a goal, because I think most of the initiative has been more of a push system, and in the past we've been trying to capacitate internal mentors to ensure that the QI becomes a culture. And we're hoping that at the end of the year, there'll be another progress assessment to assign stars, or whenever the facility requires it. So facilities at the same level will be benchmarked so that to bring a sense of competition, and the facilities will be recognized in terms of the progress that they are making. The idea for this program is not, the idea is progress is QI, or the movement. So facilities will be at different levels, and we'll be celebrating the movement of facilities up that ladder, irrespective of where they are starting from. Next slide. So what are the lessons from leadership? I think government and facility leadership is very important to ensure that there are harmonized efforts in terms of QI, because we, like in the context of Malawi, there are different partners, different stakeholders with different interests, and sometimes the efforts can be duplicative. So, but if you have got a strong leadership driven by government, you can be able to maximize the resources that are available to improve the quality. I think the other issue is also to balance between verticalization and also verticalization, and at the same time ensuring that we having an understanding that quality is also quite cross-cutting. So I think that trying to strike that balance where you're trying to integrate, but at the same time you also don't want to lose priority areas like MNH, I think has been a tricky situation. We're still learning on how best we can be able to do this. I think with the integrated approach, we're hoping that we're not going to lose again in the prioritized areas of, for example, the MNH gains that we have had. I think the other issue is also about funding. There's need for more funding, both internal from government resources and also external. External. I think we still need support from partners. We've gotten a lot of support from partners in terms of implementation of the MNH QoC activities. Of course, the challenge has been that, as I have indicated, most of the QI plans were outside the plans of the facility, and they were seen as projects. So going forward, we would want alignment so that funding to QI is from both government and partners. Next slide. So under action, as I've indicated, we've develop an MNH QoC package and a clinical mentorship package. We did conduct quality of care assessment in 25 learning care facilities, which were followed by quality improvement plans. And the main gaps were around availability of reference protocols, gaps in the continuous professional development, stockers of drugs and supplies, issues around incomplete documentation and not adhering to the treatment guidelines. We have done a number of capacity building for QI teams so that the frontline health workers have got the capacity to use the QI models that we are advocating. So Malawi developed a QI model. So what we did was just to combine different pieces of models and put them together and call it the Malawi QI model. And that's what we've been capacitating the learning facilities. We also developed the continuous professional development platform. Currently, it has got 8 modules around MNH. We are hoping that this platform is going to expand so that it provides an alternative way of doing capacity building for frontline health workers. Next slide. So around mentorship, so we had a mentorship program. So the aim of the program was to capacitate district mentors and facility mentors so that they can be able to do continuous mentorship. So national mentors were paired with the district mentors and facility mentors. And we supported intensively within a window of 6 months. And during these 6 months, their skills were assessed, they were supported, hoping that by the end of the 6 months, they would have gotten QI facilitation skills so that they can be able to support their fellow providers on the ground. And what we, for each district, four national QI mentors were identified to support 12 mentees. Next slide. And what we have seen, we've noted that there's been an improved QI skills, not only with the mentees, but also the work improvement teams. And some of the teams were able to present during the National Quality of Care conference. And we've been able to graduate a number of, we've been able to identify district QI mentors that are able to conduct QI support within the district. Next slide. So showing some statistics in the facilities that we're implementing the mentorship support. And this is from routine data collected through DHIS2. What we noted at Camus Center, so the graphs are showing maternal deaths per month and neonatal deaths. And at the Camus Central Hospital, which is one of the referral tertiary facility in Malawi, we noted that there was no change in terms of the maternal deaths during the time that the facility was undergoing mentorship. Similarly for neonatal deaths. Next slide. Similarly, for Zomba Central Hospital, Zomba Central Hospital was a tertiary facility, and there was also no observable change, both for maternal deaths and the neonatal deaths. For Nzimba, there were changes. So for maternal death, you actually see that there was a observable shift between February 2022 and September 2022, a positive shift and an improvement, a slight reduction of the maternal deaths. And it was quite visible for neonatal deaths. You actually see that the median deaths have decreased from 27 to 14. So there was an observable reduction in neonatal deaths. So Nzimba South is a secondary level facility. Next slide. So for Kasungu, Kasungu is also a secondary level facility. And in terms of the maternal death, there was no observable change. But for neonatal deaths, the median reduced from 28 to 19. Cholo DC Hospital is also secondary level facility. And if you can see the median has remained the same. So the median was 0. And if you can see between June to January, for 8 months, Cholo did not report any death, which is something that was quite commendable. And we also saw a positive shift in terms of the neonatal deaths, reduction between July 2021 and June 2022, and now we're seeing now an increase, and we now seeing an increase from August 2022 and September 2022. Next slide. So for Mangochi, there was so no change in terms of the median for maternal deaths. But for neonatal deaths, there was a reduction, a visible reduction from 44 to 21 neonatal deaths. Next slide. So continuing with the action, there was an evaluation that was led by the Reproductive Health Department on MPDSR. What was noted is that there were gaps in terms of staff trainings around MPDSR. There was no functioning committees at health centers and community hospitals, and the district health management teams were not actively being involved, as much as they are members of the MPDSR committee, but it was seen that they were not actively being involved in audits. And the recommendation that came from that evaluation was that MPDSR has to be integrated within the broader QI efforts, and facilities have to be supported to institutionalize perinatal death audits, and community MPDSR has to be rolled out. It's something that is not being done. So the recommendation is that it has to be rolled out. Next slide. So what were the lessons that we got from actions? we noted that the development of the essential maternal and newborn care standards has actually improved the delivery of evidence-based care because it provided guidance in terms of what is expected to be implemented. Partner engagement and participation is very critical to be able to pull resources and efforts together. And we also noted that you cannot achieve quality without quality health workers. So our health workers are doing more on the ground despite challenges in terms of staff shortages, increasing disease burden, shortage of supplies and drugs. The other issue is that we're still having challenges in terms of having a culture of quality. We've noted that there are certain cadres, of course, there's some improvement, but I think there's still a gap with certain cadres not actively being involved in QI as part of the team, and QI also being seen as an added task. The other issue is that as much as we've made a lot of progress in terms of doing in-service training, we're seeing that in terms of sustainability, we need to incorporate QI in pre-service. And the last but not least, management support is still very critical if we have to achieve any improvement within the facility. Next slide. So under learning, there have been a number of activities that we have done. We've implemented a number of collaborative, zonal collaborative learning sessions. And recently, as I indicated, that we implemented a quality of care conference. We also implemented a workshop around documentation. So the workshop was aimed to capacitate ministerial officials and QI focal person from district in terms of documentation, identifying successful change ideas, so that these are those that work form a change packages that can be scaled up. Next slide. So what were the lessons? What we noted is that we've been doing the collaborative learning sessions as parallel activities, but we've also noted that in the district, they also have different review meetings. And we are exploring that these review meetings can be opportunities for integrating the QoC learning sessions. Because within the review meetings, usually they discuss outcome data. And within the learning sessions, we're discussing process. We mainly focusing on looking at the processes that we've been able to improve. And I think these elements are quite complementary. And we think that there will be an added, it will be more useful to do these things as the integrated, to do them together. The other lesson is that having national quality forums also provides a good platform to harvest and share learning across districts. The other point is establishing a national learning center. So what we've noted is that a number of success stories that we can be able to point out. And but one thing that maybe we have not done well in terms of ensuring that what has worked is kept, so that others can also be able to take advantage of that when facility would want to address a similar problem. So we are thinking of establishing a national learning center for sustainability of what works, even those efforts that have not worked, so that they are not repeated in future. Next slide. Under accountability, number 9, accountability, we established a hospital ombudsman. So the focal person provides a platform where clients can be able to raise their concerns to this focal person with the aim of that these complaints are resolved by the facility. And between 2018 to 2022, the hospital ombudsman in different facilities reported 4,719 cases. We know that they could have most likely the number of cases is quite higher, because we've also been having challenges in terms of routine reporting. And at national level, we're trying to support the facilities to ensure that we strengthen this area. We also have got community committees known as health center management committees. And within these committees, they have got a subcommittee on grievance redress. So this also offers an opportunity or an alternative. If a client is grieved, they can be able to go to this committee, so that the issues that they are complaining about are addressed. We have also been advocating for hospital charters to be displayed in facilities to sensitize clients on their rights and also services that the facilities are providing. Next slide. So in terms of lessons, we've noted that we need to do more in terms of community engagement, particularly in planning, so that we're able to address some of the challenges within the MNH QoC implementation. As I've indicated, the hospital ombudsman has been a success, a critical accountability tool, but at the same time, they have also been concerned in terms of conflict of interest, because currently the hospital ombudsman is a staff within the facility, usually from the administration, and they've been caused to have the hospital ombudsman idea to have somebody who is independent from the facility to take that role. We still engaging with our colleagues from the hospital, from the National Office of the Ombudsman, to consider establishing this position. But at this point, the hospital ombudsman are working as the customer care officers to ensure that if a client is grieved, their issues are taken forward to inform improvement within the facility. We have also noted that, and I think this has been there, that service users still do not have the capacity to demand quality. We still not getting as much feedback through the different mechanisms that we have, that the ministry is pushing forward. And we hope that with the more community sensitization, we'll get more utilization of the different accountability structures that the ministry is championing. So what are the next steps? So beyond, as you're aware that this is a last year of the network, and we're not sure of what is going to follow in terms of the global support. But I think as a country, we are still thinking in terms of how do we take the gains that we've learned from the MNH as a pathfinder to inform what we're going to do next as a country, so that we do not lose the gains. So in terms of leadership, we will still strengthen participation of partners and stakeholders, because having stakeholder buy-in is very important if we have to sustain the gains. So having meetings where we can have collective decisions in terms of what are the priorities in terms of improving MNH. So I think that will be critical. In terms of action, we as a department, we're championing to harmonize different QoC data platform. In Malawi, the number of platforms that are being used to collect QoC data. The meetings that have been planned to ensure that we harmonize these efforts, because this is also bringing one duplication, and most of the platform also have got incomplete data. So for this platform to better serve the country, there is need of harmonization, and this is an effort that we are prioritizing in terms of our next steps. For learning, as I've indicated, we'll be talking to our colleagues that are championing the review meetings, so the planning department, to ensure that to see possibilities of integrating QoC collaboratives and the review meetings. We'll continue doing the national. We'll continue doing the national QI collaboratives, because these provide a good platform for learning and sharing best practices across the country. And we'll also be pushing with, I think, support from WHO. We've been engaging WHO to help us establish a national learning center in collaboration with a local university, so that we can have sustainability. For accountability, data is also very important. And we are mobilizing resources so that we can have a new demographic survey. As you show in my first slide, I showed you outdated data. We are really looking forward to have another survey so that we can have current statistics for Malawi. So that's all that I had. Thank you for listening. Sorry, there's a very last slide. So And then most of the points I've already talked about. One, in terms of high dependence on donor support. I think support of the donors for Malawi is still relevant. But I think we are looking forward to a time where district also use their resources to invest in QI initiatives. We still need to have investment in terms of a number of health systems gaps that are there, issues to do with staffing, infrastructure, supplies. I think that's an issue. And if we have to improve quality, we cannot just focus on process improvement, but we also need to ensure that we are supporting facilities and districts to address these gaps. I think the other issue, which has also been a challenge, is about outbreaks. So I think COVID-19 has been global, but I think recently we've been hit by cholera, and this is also pulling us back. So thank you very much once again for listening, and looking forward to your comments and feedback. Thank you.
Great, excellent. Thank you very much, Dr. Bongani, for this very rich, interesting, and comprehensive presentation. We have a few minutes left of this webinar, and we've received quite a few interesting questions, which I would like to direct to you. I'm not sure if we are joined by Dr. Malangis or if he's still having some connectivity issues. But in the interest of time, I will pose a few questions to you, Bongani, and we'll see if Malangis is also there to be able to address them. So maybe the first question, which from what we've received seems to been quite interesting for the listeners. So you showed a slide or a few slides on the facilities that have a reduction in newborn mortality. Do you have any more information on what changes that were made in those facilities that could explain these reductions? So that's the first question I have to you, Bongani.
So thank you very much for that question. So recently, what we've been doing at national level is to look at the QI initiatives that were shared through the National Quality Forum, so that we can be able to understand what really worked. And we've been documenting some change ideas, so that we can be able to form a change package that can be scaled or can be shown that it has worked. What we have noted is that as much as the facilities can be able to show that they have made improvement, I think there have been a challenge in terms of data. So most of the change ideas, because we're using some tools that we shared to us by WHO to look at the change ideas, so that we assess if really they have really made a difference. But most of them fell short, and I think that's an area that we'll be working with the facilities to ensure that we improve on data, so that at national level we can be able to confidently say that in this facility, these are the specific change ideas that really worked. So in short, at national level, we're making efforts to ensure that we collect the change ideas that worked, but they are changing in terms of data, and we are supporting a facility to ensure that we improve on the data. Thank you.
Great, thank you very much, Bongani. And I actually think you answered a few of the other questions that was similar to that one as well. One other interesting question is, you presented here, and we understand that Malawi chose MNH kind of as a pathfinder to see on how to institutionalize and use QI as a mean to improve quality of care. So there's a question to see how these have informed in terms of other programmatical areas. So have you yet been able to translate what's been done for MNH into other programmatical areas, or also if there's a plan to expand beyond MNH in the coming future?
Yes, thank you for that question. So the plans are there, and I also did present the efforts that we have done in terms of developing the National Quality of Care Standards. Actually, most of the learning we have gotten from the MNH QoC standards. So in terms of the framework, how the framework of the standards, most of it has been from MNH. For Malawi, I think we don't have a choice because we're working with limited resources. We cannot afford verticalization. I think we've been doing verticalization, I think, for some time, and in the new Health Strategic Plan 3, there is a lot of emphasis on integration to ensure that the programs that do not have funding are taking advantage of those that have got funding, to be able to cover the gaps. Like within the network, we've been getting a lot of support from WHO in terms of implementation of different activities. As it stands now, I mean, we're not sure if that funding will continue, but they're important activities. So in terms of integration within the National Quality of Care Standards, we ensure that the MNH QoC standards, as we're implementing the National Quality of Care Standards, will still be implemented, whether we have got continued support from WHO or not. So I think that's the direction that we are thinking, and we have really learned a lot from the network and also from the QoC initiatives.
Great, thank you very much for that answer, Bongani. And I can see we're actually right on time, on the hour. So with that, I would like to say a big thank you to Dr. Bongani and the Malawi team for presenting this very rich experience with us. Also like to thank all the people who attended this webinar, which is the last webinar for 2022. But there will be upcoming webinars in this series. So we're looking forward to one from Sierra Leone, where we will have input and outcome from their second National Learning Forum, which was held in December 2022. Slides will be shared with the participants after this meeting. So there you can also log on to and learn more about the series, and also visit the website of the Quality of Care Network to learn more about this. Once again, thanks to everyone. Wishing you a nice continuation of the day, and I'm sure we'll be in touch in the future. Thank you very much. Goodbye.
Thank you. Bye.
Thank you.